Hello, I'm Dr. Brandt Gibson. One of the common injuries that happens in foot and ankle are fractures. And I want to go into fractures a little bit, especially focusing on stress fractures. But before I do that, let me tell you a little bit of a story here. When I was young, actually really quite young, I actually broke my ankle and was placed in a cast and progressed from the crutches on a cast to a walking cast. And that was a big deal. I really have never forgotten that process, that issue there. But let me give you a background on how this happened. So in one of the parks, it was in Alpine, Utah, there was a park that actually had a merry-go-round. Instead of being the flat merry-go-rounds that you push and everybody sits on top of it, was a rounded one. It looked almost like a little mountain, a little hill, and you would hold on to the sides and they'd spin you around that way. But we had the brilliant idea of saying, well, let's crawl underneath, because there were bars that go across this. We'd crawl underneath and we'd get on the bar and they'd push us from the outside and you'd be on the inside spinning around, and it was really quite fun. And one of the times while I was doing that, my foot slipped off the bar and I caught it between the bar itself and the bars that were connecting the merry-go-round to the ground. And so it twisted it and it broke my ankle. And this was the reason that I basically ultimately injured my ankle in this process. So fractures are a big deal. An interesting thing, the first fracture that I had as a child was in the area that I now work, foot and ankle. It was a fractured ankle and I was put into a cast. So a lot of people say, okay, what's the difference between a fracture and a break, or a broken bone and a fracture? They're really the same thing. A broken bone is a broken bone is a broken bone. Whether they call it a fracture, whether they call it a broken bone, whatever, really what it comes down to is the difference between types of fractures. And there's really three different groups is the way I would describe it. One is a stress fracture. That's what we're going to talk about today. And then the other two are just normal fractures. And as I explain stress fracture, you understand what the difference is. And these two are fractures. They're a non-displaced fracture, which is a fracture that's in the position it's supposed to be, and a displaced fracture, a fracture that moves out of position and needs to be treated more aggressively. So I'm not going to talk about those two at all. We're going to talk about stress fractures. So the difference between a stress fracture and these other two types of fractures is the extent of the injury. So in a fracture that's just a stress fracture, it's a little crack in the bone. You may have a little bit of disruption of the cortex, but it doesn't even go halfway through or fully through the bone. Most of the time, it's a small area of the bone that actually is involved in the fracture. A lot of times, they're difficult to see on normal plain film x-rays. So often they're not diagnosed for 14 days. The advantage of newer technologies, computer x-rays, computer-assisted imaging, those kind of things, is we can zoom in, we can clarify, and we can actually see stress fractures basically right after they happen. And that's a huge benefit, a huge change. But because of that, a lot of times fractures are missed if you go to an Instacare or emergency room, those kind of things, because they're not doing any of this clarifying, they're only just looking at it at a deeper level, like I would commonly do in my office. So a stress fracture is a crack in the bone. Because there's no possibility of displacement, because there's no way that it would not be in position, these are a lot less severe injuries, but they hurt just like any other fracture does. They need to be treated similarly. Many stress fractures in the foot and ankle will heal almost no matter what you do, but by continuing to stress it, you're slowing it down, and you can cause a stress fracture to progress and get worse. The most common stress fracture that is seen is what the soldiers call a March fracture. It's an overuse type injury where you're stress a metatarsal to the point until it cracks. And if you continue to stress that exact same metatarsal the same way, so you continue to march, continue to run, you can actually create a through and through fracture, a full fracture that goes all the way through the bone that initially is non-displaced, but if you continue again, then it will displace and ultimately lead to surgery. So what do we do for stress fractures? Same thing we do for other. We limit activities, or rest. We ice the area to decrease inflammation and decrease the pain. We compress it. We're going to wrap it with something to keep the swelling down, because that also decreases pain. And elevation, getting off of it, getting it elevated so that gravity can help you, assist you in getting it better. That's the best thing to do. And that's usually where we'll start. Then a lot of times you're going to immobilize it, whether that's in a special shoe, boot, or go on to crutches or something like that. Most of the time with stress fractures, you don't need to be on crutches. You can actually walk in a boot or a post-op shoe that just minimizes the motion so you don't continue to stress it. And really what it comes down to is it's just going to get better over time. There are things that can speed it up. We have a form of MLS laser, multi-frequency laser, that actually treats the area and can cause it to heal quicker. We have herbal nutrients like Dr. Christopher's Bone and Tissue that can improve the healing. And there are ways that you can eat more appropriately to similarly improve the healing, whether you're eating the right amounts of protein, whether you're getting the right nutrients for healing, vitamin D, calcium, some of those kind of things. So the point is, stress fractures are less severe fractures, but they should be treated similar to any other fracture. And if you do that, they can get better pretty quickly. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 328, Stress Fractures.